A nationwide report on life expectancy was released this week, and the news is not good. On average, Americans have lost nearly 3 years of life since the number peaked at almost 79 years of age back in 2014. And the decrease in Oklahoma is even more pronounced. What's to blame, and how can we possibly get some of those years back in the future? To find out, we're joined by reporter Kennedy Sepulvedo. Kennedy.
Rich, that report by the Bloomberg American Health Initiative and Johns Hopkins University provides 10 strategies to improve life expectancy. The initiatives are all based on preventative measures for the 6 leading causes of death nationwide. When the COVID pandemic hit in 2019, the decline in national life expectancy rate accelerated at a rate that is compared to declines recorded during World War I and the Great Influenza of 1918.
Back in 2016, we recognized that life expectancy was on a decline. We know that there were gains that were made in the last several years. However, the recent COVID and infection rates and a number of other factors have contributed to the continual decline or the recent declines that we've seen in life expectancy.
The national rate is 76.1. Here in Oklahoma, it's much less than that.
Preliminary estimates for the period life expectancy for Oklahomans as of right now is 72.8 years at birth. That's actually 3.3 years lower than what the national rate is currently calculated at, given that it is still provisional estimates. That gap is a little bit larger now than what it was in 2019. In 2019, the gap was about 2.7.
Life expectancy rates can be calculated in multiple ways.
One is to take a cohort or a set of individuals that are born and track them over their entire lifetime. The way that the National Center for Health Statistics and the life expectancy that was evaluated in the Johns Hopkins report is done with a period life expectancy.
We look at population health. We look at the markers where specific communities are in terms of race and ethnicity. And then we measure those based on how those populations are doing in communities across the country.
Life expectancy by race shows Asian Americans have the longest life expectancy rate at 83.5, 2 years less than it was in 2019, while American Indians and Alaskan Natives have the lowest life expectancy rate at 65.2. That number has fallen more than 6 years since 2019.
How does equity play a role in this? How does race, ethnicity, gender, geographic location play a role in thinking about equitable solutions to the way we approach health and the way we're thinking about increasing life expectancy in this country?
The 10 initiatives to stop the decline of life expectancy are preventative measures researchers believe would limit premature deaths caused by COVID-19, overdose, gun violence, teen suicide, motor vehicle crashes, heart disease, stroke, diabetes, and weather events. Initiatives include changing state or federal policies, increasing funding for local health, food, or intervention programs, introducing healthcare programs into schools, and community-tailored programs for healthy living.
We also, as a step, think about prevention and we think about treatment. How do we ensure that programs are available, that treatment is available for individuals who are experiencing substance use disorder? And what are we thinking about in terms of policies to prevent firearm injuries?
Most of our programs look at the prevention side of things, which will help people live longer and healthier lives, so it's a quality of life issue. Also, prevention is a whole lot cheaper than treatments.
The Tobacco Settlement Endowment Trust, better known as TSET, has multiple programs geared towards helping Oklahomans make healthy lifestyle choices.
If you can get people to develop those healthy behaviors like, being tobacco-free, getting regular physical activity, and eating nutritiously, it can save both them and the state a lot of dollars in the long run when they're not seeking treatment for heart disease and lung disease and cancer and issues like that.
Oklahoma's leading causes or provisional leading causes for 2021 are diseases of the heart, cancer, all forms of cancers, COVID-19, accidents and unintentional injuries.
Programs such as TSET's Shape Your Future align with initiatives researchers suggest to address heart disease, stroke, and diabetes. That initiative, Improving Diets.
And it really focuses on helping Oklahomans eat nutritious food and get moving. So you have recipes for quick, healthy dinner ideas, lunch ideas. There are resources for parents who want to get their family moving, like ways to be active around the house. You know, in wintertime, it can be hard to get outside and be active. So what can you do without leaving your house?
Researchers note it's important for initiatives to be designed for individual areas and communities.
Oklahoma is rural, so what are some of the interventions that public health can be using to address what is happening in rural Oklahoma versus what may be happening in a place like Philadelphia? And some of those measures may be very different. But again, thinking about those interventions and tailoring those interventions to the communities.
Our Healthy Living Program grants that put health experts into communities to work on policies and projects that will really help improve health at the local level.
Some steps researchers suggest to stop the decline in life expectancy are underway in states throughout the U.S. As for where programs and policies are lacking,
it's an opportunity for us to work with our partners and the legislator across the country, and also in Oklahoma. And what are some of the lessons that can be learned from other cities and other states across the country that can help inform what we should be doing in rural, in urban, in suburban communities all across the country, including in Oklahoma.
some of the initiatives, for example, gun control policies to address firearm deaths, are currently not legal under Oklahoma law. Other suggestions must be applied at the federal level.